The phrase G-Health is going to be on the lips of all Gauteng citizens in the future. It is the vital and evocative brand which forms the key to the dynamic communications and service initiative being introduced to the public by the Gauteng Department of Health, premised on the turnaround strategy. Health services across the world are too often subject to public criticism, founded on misconceptions and poor communications. A challenge which requires a responsible and positive response.
Well, the department has got a very long history, and unfortunately the history has its good, but there are things that we're not happy about. So through this brand launch, G-Health, we hope to be laying a foundation which would provide our patients and those that we serve with a totally new experience. There are new values that we've adopted, which we embrace as a Department of Health. We continuously strive to ensure that the experience that people get from our services will, for the first time, hopefully for the better, show them that there's a department that is committed, that is caring, and that indeed we mean business, and that hopefully we're going to make a valuable contribution in ensuring that the Gauteng provincial government achieves its objective of building a healthy, productive, and happy people.
The Gauteng Department of Health has stepped into that breach with the G-Health brand, which forms the foundation for an all-embracing, practical service development and communications program aimed at generating an enthusiastic and supportive response to improved health services and full participation by citizens in improved individual lifestyles in Gauteng province. This major fresh strategy and the far-reaching communications program which will support it dovetails with the powerful global trend towards supporting and driving initiatives aimed at promoting healthy lifestyles and providing a quality and affordable health service to the people who need care and rehabilitation.
Look, change is very interesting because it's a process. So part of change is to begin to put a picture and give people a picture to say, this is how we would like to be, and this is what we are aiming for. And as we keep on changing towards that goal that we have set ourselves, people will begin to believe, we'll set ourselves milestones, we'll say, this is what we'll do, and look at the space in relation to the brand, So we are promising something through the brand, and that will be sort of our mark and our map as well, in terms of how we relate to the public, and also with our staff, because in health, really, staff is of critical importance. Health is driven by people.
The exciting new G-Health brand developed by the department will impact on public awareness through community outreach programs, radio, television, and print campaigns, and all of it backed up by a broad-based communications plan designed to encourage participation from all stakeholders in the health sector.
The brand itself is not going to improve the service. The improvement of the service rests on people like myself, the doctors, the nurses, the support staff that we have in the institution. But the branding will also give a kind of sense of loyalty to the individuals who work within the public health system. And I'm sure will, from their perspective, also give them a commitment to wanting to live this new brand that is currently being marketed. So I think it will also begin to change the attitudes of our health workers themselves, and increasingly bring into focus the need for us to get more concerned about this whole area around a more caring and compassionate environment.
And that's why when you look at some of the initiatives that are even currently underway, like promotion of healthy lifestyles, being able to focus on issues of prevention, promotion, there are some very useful initiatives, but they kind of get lost in the wood. And I think those initiatives, to try and help brand them, is to link them with something that people can begin to really imbibe as, this is different. And I think it starts with even ourselves as the service. These changes, people are hearing things about it, they don't really understand it very well, and it sometimes can be difficult to convey it. Attaching something that's clearly different, well encapsulated as a package, I think will get a lot of buy-in from the service, and eventually a satisfaction of our clients.
The G Health brand is a simple and highly effective design based on the circle motif of the Gauteng provincial government and using the department's vision, health for better life.
We are learning as well in terms of we have existing codes of arms of different hospitals, and it is the first time that that really they are engaging us to say, so what will happen to our brands, you know? And we said we will work out. Some of them will stay, some of them will become just logos, but something will have to give because we want everybody to be in line. So already, you know, CEOs are seeing the impact of this in terms of what they've been doing before, but a lot of them are very happy, you know, that for a change there's something that will be binding all of us together.
The quality healthcare program built around 4 primary pillars, the first of which is the promotion of healthy lifestyles and the prevention of disease among the people of Gauteng. The second pillar focuses on the strengthening of existing services already provided by health facilities. And the third, on our commitment to ensuring the delivery of quality health services that are both affordable and sustainable in the treatment, care, support and rehabilitation of the people. The fourth pillar in the quality healthcare program is the strengthening of the entire healthcare management system.
Public health services are currently undervalued, and they're undervalued for all of the wrong reasons. And I think that if through this branding exercise, we'll be able to position public health services at the right level, and also to get our patients, firstly, to demand what they should be getting, and secondly, for us, for those of us that are working in the public service, to understand what the expectations of the people that we serve are, and be able to match that expectation every time.
It's important that we as service providers out there don't also look at as being recipients of this branding as, okay, it's coming from above and okay, it's just a new label. I think we need to look at ways we seek out projects that speak to our differences as really us initiating something to say we'd like to get the branding up there to show up. That, you know, yes, we're struggling with the ordinary service delivery, but here's an initiatives to try and improve it. Let's attach the brand to it so that it also is not drowned out, our efforts. I think there are lots of people doing wonderful things out there.
G Health is designed to educate and inform the people of Gauteng of the improvements to facilities such as hospitals and clinics and the effectiveness of service delivery while promoting healthy lifestyles and encouraging interaction from the public. The demands and challenges of the health system are ongoing. G Health has been designed as both a proactive and interactive campaign to meet those challenges and at the same time build public confidence and awareness of the department's achievements and the successful delivery of the quality healthcare program.
Hopefully around this brand would be able to mobilize firstly our staff, our management, and then of course the patients that we seek to serve. It would be an anchor that would use consistently in our communications effort to talk about the values of integrity, of forward thinking, of caring, of being committed and being accountable. Hopefully it's something that all of us, when we look at, will continuously remind us of these values and what the department strives to achieve, which is a better health for all.
The Gauteng Department of Health is leading the way in the campaign to secure the hearts and minds of our citizens and all stakeholders in the constant battle for an improved and sustainable quality of life. G Health for a better life.